So my name is Rachel Cady. I'm an obstetrician gynecologist. I work at Cuyuna Regional Medical Center in Crosby, Minnesota, and I've been in practice here for about 14 years. So a midurethral sling is a surgery. It can be either a mesh implant or a fascial implant using somebody's own tissue, but more commonly a mesh implant that's placed underneath the urethra. So it's placed vaginally to re-support that urethra for purposes of help with stress urinary incontinence, the type of incontinence patients have when they leak with activity like cough, sneeze, jumping on a trampoline, running, walking, anything that increases your belly pressure. And that results in what we call stress incontinence, involuntary loss of urine with activity. So patients with stress urinary incontinence will come in again, describing involuntary loss of urine, usually with activity, exercise. It's inhibiting their quality of life. Usually they've done other things to try to deal with it, like unfortunately decreasing their activity, which is never a good long-term answer, especially given that the average woman's living into her mid-80s. So it tends to be a problem that gets worse with time, not usually something that gets better with time. And so the underlying issue is more of a support problem to the urethra, which is the tube that comes out of the bladder to our outside world, if you will, where the urine exits from our body. And a urethra in a female is about 4 to 5 centimeters long or close to 2 inches long. And so when that support, like a shelf of support tissue behind that mid-urethra is compromised, torn, however the term is that you'd like to use, but when there's poor support to the urethra, any increase in belly pressure results in pressure on the bladder, and there's not that shelf of support behind the urethra to keep the urine in. And so the urine just comes out involuntarily with, again, things like coughing and sneezing, etc. And so there's no medication at this point for stress urinary incontinence because it really is more of an anatomy support issue. And so really the treatment options for stress urinary incontinence is things like physical therapy, which is a very useful modality. It typically improves stress incontinence by about 50%. Also, weight management is something to consider as well. But then the other option is more of a surgical intervention, re-supporting that mid-urethra. And since the late 1990s, what has been FDA approved are these sling procedures. And again, that's typically a small piece of mesh that's placed underneath the mid-urethra in the operating room. It's usually about a 20 to 30 minute procedure, and that artificially re-supports the urethra. This is done either under a deep sedation or a spinal anesthetic or a short general anesthetic, same day procedure. Now, no procedure is completely no risk, but this is certainly a very low risk procedure. Since this has come out since 1997, there's been almost 3 million done worldwide. And for stress urinary incontinence, the data is almost 90% of women are happy with their results after surgery as far as for relief of stress incontinence symptoms. And the long-term data has been shown that for the 90%, the vast majority of them at this point, again with 20 years of data out, stay dry, or at least happy with the degree of dryness that they experience. There's been a lot in the news about mesh, particularly in the last 5 to 10 years, being a foreign body and any risk associated with that. And what happened was in 1997, when this came out as an FDA-approved product, there was a lot of other companies that kind of jumped on board and came out with their own products and were not properly tested before being approved. And so it was found that there were several companies that had an unacceptably high rate of erosions, pain, infection, those kind of things. And those have since been taken off the market. And so a patient can certainly look on the American Urogynecology website and see the physician's statement on slings. Again, it's not to say that they're not no risk, but for the vast majority of patients, this is a very satisfying procedure, improving quality of life, and certainly a very low risk procedure. The actual sling heals in over the period of about 6 weeks. And so we do ask patients to really be mindful about any heavy lifting. Again, somewhere in the area of about 20-pound restriction for 6 weeks. They can walk, they can go to work, they can drive their car as long as they're not on narcotics, things like that. They're really trying to stay away from weight lifting type things, avoiding lifting too much. But nothing vaginally for about 6 weeks, while the small incision in the vagina, which is just about 1.5 centimeters in size, while those sutures heal up. So avoiding anything in the vagina for about 6 weeks or any heavy lifting for about 6 weeks. We see the patient at 1 week and 6 weeks to assess their symptoms. Pain management is usually not really an issue. People do have some degree of discomfort, particularly kind of more muscular movement, those kind of things. We do send people home with a small number of narcotics and ibuprofen if they're able to do that. Usually people take a very short amount of time off work, sometimes a day or two, really kind of depending on the patient. But those are the main restrictions. So the best way to get a consult with us is to either self-refer, calling our OBGYN clinic at CRMC, or having the primary care clinician place a referral.